That's a, a great question. Far-reaching, obviously. 25 years in the future, I would imagine I'll be retired by then, and you'll be one of the leaders of the organization by then. It is interesting because I've been a part of ORS for just about 25 years myself already. 23 years, I think, is the when I joined. The ORS has really made, I think, great strides in becoming more inclusive and a more member engaged group since that time, since I first joined. The initiatives like the Women's Leadership Forum, and then the recent development of the DEI committee. But one of the things I hope that in 25 years, we're a much more diverse and group, and that we're much more engaged globally in a much more deeper way. We obviously have a lot of members that are international, but I think we could do much more at a global scale, and I'd like to see us do that. So that's one thing. I also would like to continue to advance the organization being more open and transparent. I think that's really important to make everybody feel welcome and to make sure that everyone has a voice. And I think that we also could play a role, and hopefully we'll continue to play a bigger role, and this can develop over time, in engaging and promoting research to the public. I think we're seeing right now the problem with a lack of scientific literacy in the public. And I think that we in our organization, we're orthopedic scientists, but I still think we have a role to play in making sure that everybody's informed about the science. And then maybe one final thing that I hope where we are in 25 years is more engaged with other organizations. I think that we have a lot in common with, for instance, the ASBMR, and it would be great to build relationships with organizations that are closely allied with us, but then also to build some connections with organizations that maybe we wouldn't immediately think about as being important, such as the Society for Neuroscience or the American Association for Immunology, things that might touch musculoskeletal diseases but are not perhaps readily apparent. So those are perhaps places that I'd like us to be in 2050, right?
Great.
Yeah, that's great. It's good to think about. I think I served on the membership committee. I led the membership committee at one point, and that was one of my first bigger roles in the ORS. And so I had a lot of time to think about what's good about the group. And I'm a part of other organizations, and so why the ORS versus something else is important. And I think one of the things that is really unique about the ORS is that the organizational and functional structure of the ORS that's developed over many, many years is both the diversity of the subject matter expertise and the diversity in training and background. So, the ORS has this principle of having surgeons, engineers, and biologists all having equal footing in the organization. And, we can put people into simple categorizations, but and obviously there are engineers that are clinicians and that also are focusing on biology, but those three sort of categories I still think encompass what all of us are. And I think what that means for a potential new member is that new member gets different approaches to how problems are solved and can gain exposure to a much broader and diverse research topic areas. So I think that that's one thing I would promote. The other would be that the ORS is frankly a fun, friendly, interactive group. I've truly met some of my closest friends in the world, through the ORS, the people that transcend relationships that transcend science. And I know of many other colleagues who also have similar friendships like that. And then perhaps a third thing that I would say that's perhaps somewhat related to the first is the relationship with clinical and surgical orthopedics. And so that really drives this very translational agenda for the organization. And it is one of the things that has kept me involved over many years. And when I think about it in contrast to other organizations, is that translational relevance, I think is very key to the success of the ORS and its uniqueness. Yeah, I guess I would have trouble focusing on one way, because I'm not sure I believe there's one path. I think there's probably plethora of ways and opportunities for members to be engaged. Some, like yourself, are getting involved from a very early stage and being actively engaged in the organization. And I think that's great, but there might be other people who are content with just capitalizing on the scientific content or training opportunities that exist for their trainees. And I think that that's fine too. What I want to make sure, though, is that however one decides to get involved into whatever depth that each individual member feels welcome and valued, and that the organization is satisfying their needs. I think that's really what is most important to me, is that everybody feels valued regardless of what their role might be. All that being said, I guess I would say that I do think the sections are a really great way for people to get involved. That's sort of more grassroots and perhaps a little more casual. The way those grew up was very grassroots. I was involved in starting the preclinical model section, and that was a great way to engage and meet new people in the community. And then, I would say perhaps one other way would be the ambassador program. And the ambassador program, is more locally oriented groups. And so that would be another way that people could get involved at sort of a more local level, rather than perhaps thinking they got to try to conquer or, not conquer perhaps, but be involved at a much larger scale. Well, that's kind of a tough one, but I like to give unsolicited advice, so I'll give it now since it's been asked for. I think one big thing I believe in is that I'm a big believer in people finding passion and being passionate about what they do. There have been times in my own career where that's waxed and waned, but I think if you can find passion in what you do, that will be very sustaining. The job as a scientist is hard, whether it's academics or industry or government, whatever role you might be playing as a scientist. Long hours, it can be slow and frustrating. There's not great pay. So loving what you do becomes very important. Perseverance is another trait for success, I think. So, again, going back to long hours and lack of success, you're sitting at a microscope or under the tissue culture hood, or you're at a computer, and sometimes lots of things don't work out. And so you need to realize that every run runs into those problems. However, the flip side of perhaps the perseverance coin is the idea of relaxing and recharging. And so I think it's also imperative to be able to be willing and able to take breaks. And so when your difficulties, you're running into difficulties, or your passions are waning, that's a good time to stop and take a break, go for a run. Which I'm going to do after this, have a beer with a friend, which I'm going to do after I go for my run, play some football, whether that's international football or American football, go for a bike ride, whatever relaxes you. So another piece of advice I would have is find multiple mentors. Don't rely solely on one person. Get different perspectives, build a network. And I think that's really important. Most people are very willing to give of their time, and I think that can be key. Meet lots of people from diverse backgrounds and experiences. These people will become your collaborators, lifelong friends, as I described earlier, and will be very life enriching. So try not to remain too insular in the people meet more people. Try to be exploratory and innovative. I think that's a key one in every way that you approach life and science. Related to this, related to that sort of concept of innovation with respect to science, I think you maybe need to carve out time to be innovative. So, step out of the day-to-day toil and try to find mechanisms where innovation can be promoted. I think that's key. So, yeah, that's probably enough advice for now. Strength assumes there are strengths to have. Okay, so let's see. What would a strength be? So, I guess I think at this point in my career, one thing that I've focused on that is perhaps recognizing, is recognizing what my strengths and weaknesses are. So, and that took me a while, I think, to figure out that that was an issue, right? Not knowing who I was, right? So sort of self-awareness, I think, was important for me for my success. So I'm become over time much more aware of where my strengths lie and where my weaknesses lie. I recognize my own faults and my limitations. And I think because of that, that permits me to be more forgiving and giving and kind and supportive, right? So my assumptions are not that somebody's doing something wrong on purpose or purposely making a mistake, but rather that, we're all flawed and none of us are perfect. I think that helps me to be a better mentor and trainer. But recognizing weaknesses, there are some weaknesses. All my mentees and people I've trained over the years will tell you I'm disorganized and probably not as available as they would have liked me to be. But I hope that when they've left working with me, that they feel that they've been supported and given the benefit of the doubt. So I think that the other side of that is recognizing strengths and weaknesses has helped me to build relationships with people, whether it's trainees or maybe whether it's collaborators, where my strengths are valued, and trying to build relationships where people don't expect me to be something that I'm not, but recognize me for what I am. And similarly, I recognize them for who they are and what they might bring. And, so my skill sets get to shine and their skill sets get to shine. And I think that's a way to build really productive, collaborative research teams, which, I think I'd like to believe that that's been one of the most successful aspects of my career, is the ability to be part of collaborative teams, whether it's, within my own lab or, the orthopedic research group at Michigan, or whether it's a larger community of scientists that I work with. So, yeah, that's what I would say.